4 Chinese cities with a total population of 20 million have been put on lockdown, and Beijing has cancelled a number of major public events in an attempt to contain the spread of a deadly coronavirus outbreak. Authorities banned transport links from Wuhan, the capital of Hubei province, on Thursday morning, suspending buses, subways, ferries, and shutting the airport and train stations to outgoing passengers. Later in the day, the nearby central Chinese cities of Huanggang, Ezhou and Chiba also announced traffic restrictions to prevent residents from leaving. In Wuhan, supermarket shelves were empty, and local markets sold out of produce as residents hoarded supplies and isolated themselves at home. Petrol stations were overwhelmed as drivers stocked up on fuel, exacerbated by rumors that reserves had run out. Local residents said pharmacies had sold out of face masks. People who sought treatment in Wuhan had been turned away from hospitals, which have been inundated with patients. Facilities are reportedly running out of beds and diagnostic kits for patients who present with fever-like symptoms. Footage posted on Weibo that appeared to be taken inside Wuhan's hospitals showed scenes of chaos and despair. In the city of Wuhan, where most cases have occurred, the race to build a new 1,000-bed hospital in just 6 days began on Thursday night. Diggers and bulldozers beginning work on the site of a holiday complex once intended for local workers, according to Chinese media. The World Health Organization described the outbreak as an emergency for China, but stopped short of declaring it to be a public health emergency of international concern. President Xi Jinping said during a Politburo meeting on Saturday, January 25, 2020, that China was facing a grave situation as health authorities around the world scrambled to prevent a pandemic. Health authorities in Beijing urged people not to shake hands, but instead salute using a traditional cupped hand gesture. The advice was sent in a text message that went out to mobile phone users in the city on Sunday, January 26, 2020. On Saturday, Canada declared the first presumptive confirmed case of the virus in a resident who had returned from Wuhan. The patient, a male in his 50s, arrived in Toronto on January 22 and was hospitalized the next day after developing symptoms of respiratory illness, officials said. On Saturday, Hong Kong declared a virus emergency, scrapped celebrations and restricted links to mainland China, while Australia confirmed its first 4 cases, Malaysia confirmed 4, and France reported Europe's first cases on Friday. In Hong Kong, with 5 confirmed cases, the city's leader Carrie Lam said flights and high-speed rail trips between the city and Wuhan will be halted. Schools in Hong Kong that are currently on Lunar New Year holidays will remain closed until February 17, 2020. National Health Commission Minister Ma Xiwei, speaking at a press briefing, said knowledge of the virus was limited. Ma said the incubation period for the coronavirus can range from 1 to 14 days and that the virus is infectious during incubation, which was not the case with severe acute respiratory syndrome, SARS. He had some very bad news Sunday about the Wuhan coronavirus. He said people can spread it before they have symptoms. Airports around the world have stepped up screening of passengers from China, although some health officials and experts have questioned the effectiveness of such screenings. In an illustration of how such efforts could miss cases, doctors at a Paris hospital said 2 of the 3 Chinese nationals in France who have been diagnosed with the virus had arrived in the country without showing any symptoms. If somebody is in their incubation period, that is the window when somebody who's already been infected can walk into the country and not be detected by symptom-based surveillance. On Sunday, January 26, 2020, China announced a nationwide ban on the sale of wildlife in markets, restaurants, and e-commerce platforms. Wild and often poached animals packed together in Chinese markets are blamed as incubators for viruses to evolve and jump the species barrier to humans. Snakes, peacocks, crocodiles and other species can also be found for sale via Taobao, an e-commerce website run by Alibaba. Health experts have long raised concerns about unhygienic and cramped conditions in some Chinese markets, where wild and often poached animals are packed together. The outbreak had drawn fresh attention to China's animal markets, where the sale of exotic creatures has been linked to epidemiological risks. Beijing has finally banned the wild animal trade as it should have done a long time ago. It is hardly difficult not to eat bats or snakes. The epidemic is thought to have originated at the Huanan market in downtown Wuhan, where exotic wild animals were sold. The now famous video of a woman eating a soup in which a bat is swimming, however, was not shot at this market or even in China. It's from Palau, an archipelago in the western Pacific Ocean. The precise origin of the virus is still unknown, contrary to many claims. It is only likely that it was something similar to bat soup, which is still considered a delicacy in China. Two Chinese provinces and 3 cities have ordered citizens to wear face masks in public to help control the spread of the virus. Macau, a Chinese gambling hub hugely popular with mainland tourists, has confirmed 3 new cases of the new coronavirus. Macau's Health Bureau, SSM, said the 3 new cases were detected in women who were residents of Wuhan. The US, France and Japan said they were arranging evacuation flights for people trapped in Wuhan, which has been placed under quarantine. The financial hub of Shanghai, which has extensive international air connections, on Sunday reported its first death. That of an 88-year-old man who already had health problems. There are 15 cities in China that are under full or partial lockdown by authorities, affecting some 57.2 million people. A US citizen trapped at the epicenter of the coronavirus outbreak in China described her fear of living in a city that's cut off from the rest of the country by transport restrictions. There is no sign of mutation in the Wuhan coronavirus so far, the director of the Chinese Center for Disease Control and Prevention, Gao Fu, said at a press briefing by China's National Health Commission on Sunday. He said the virus has shown little change since its discovery, adding that scientists will need more time to detect minute alterations if they occur. Authorities acknowledge that Wuhan, a city 11 million people and ground zero of the outbreak, and much of Hubei province are facing manpower and medical supply shortages. Healthcare workers in Wuhan have complained of being overstretched and lacking resources to combat the crisis. At the news conference Sunday, Wang Jiangping, the Vice Minister of Industry and Information Technology, said Hubei needs about 100,000 protective medical suits per day, but the 40 factories across the country making them only produce 30,000 daily. The Chinese central government announced it would send more than 1,200 health workers as well as 135 People's Liberation Army medical personnel to the city in an unprecedented effort to contain the spread of the virus. Wuhan is located in central China and normally a gateway to the rest of the country. But the city has now been essentially closed off from the rest of the world, with almost no one allowed to enter or leave. Ferguson, whose team have been modeling the disease for the World Health Organization, said they estimated the virus had a reproductive rate of 2.5 to 3, meaning that each person infected would potentially transmit it to up to 3 others. My best guess now is perhaps 100,000 cases right now, he said, although it could be between 30,000 and 200,000. Almost certainly many tens of thousands of people are infected. Most of the cases that have been exported to other countries from China have been mild, he said. That could mean mild cases of disease spread more easily than severe, life-threatening cases, which sounds like good news. But on the other hand, it means it is possible there will be a reservoir of mild disease in the country that goes unnoticed and can spread until it affects somebody vulnerable because of underlying poor health, who becomes seriously ill. Unlike SARS, which made everyone who contracted the virus severely ill, the new virus appears to be able to slip under the radar, he said. Firstly, there are the many mild carriers who will infect other people without necessarily being recognized. Secondly, there are reports from China of people who have infected others before they have experienced any symptoms. It may be that the authorities have not actually identified the index case, the person who infected a group of people, making it look as though they picked up the virus from someone who had no symptoms. But although only people with symptoms of illness spread SARS, scientists point to other diseases, such as influenza and some colds, that can be passed on by those who appear well. A professor and virologist at Imperial College London said many of the respiratory viruses that spread among humans do transmit even in the absence of symptoms, and it would not be surprising if the new coronavirus also did. While the current outbreak does not appear to be as deadly as SARS, it may be spreading more rapidly. That could be due to being more contagious or the increased interconnection of both China and the world. The majority of coronavirus infections may be spread by people who have recently caught the virus and have not yet begun to show symptoms, scientists have found. An analysis of infections in Singapore and Tianjin in China revealed that 2/3 and 3/4 of people respectively appear to have caught it from others who were incubating the virus but still symptom-free. The finding has dismayed infectious disease researchers as it means that isolating people once they start to feel ill will be far less effective at slowing the pandemic than had been hoped. Several experts said while it's unclear exactly what percentage of the transmission in the outbreak is fueled by people who are obviously sick versus those who have no symptoms or very mild symptoms, it's become clear that transmission by people who are asymptomatic or mildly symptomatic is responsible for more transmission than previously thought. Both the CDC and the World Health Organization, for example, note that coronavirus infections can be asymptomatic, and the CDC says the role of presymptomatic transmission is unknown. The period between reported infections is short enough that some people are probably spreading the disease without feeling ill. The US team analyzed known cases from China and other countries to understand more about the disease. Most people who develop symptoms do so on or around day 5. Anyone who is symptom-free by day 12 is unlikely to get symptoms, but they may still be infectious carriers. The researchers advise people who could be infectious whether they have symptoms or not to self-isolate for 14 days to avoid spreading it to others. Transmission is measured using the reproduction number, otherwise known as R, which indicating how many other people a typical COVID-19 case will infect on average. The larger the value of R, the easier the virus spreads through a population and the higher the number of infections. For seasonal flu, one infection leads on average to 1.4 new infections. For COVID-19, one infection leads to 2 to 3 others in the early stages of an outbreak. The mayor, Zhu Xianwang, said that 5 million people had left Wuhan before travel out of the city was restricted, leaving 9 million people still living there. That could imply that many more cases will be confirmed in other places in China over the next week or two. Chinese officials were considering extending the Lunar New Year holiday, which would delay the reopening of schools and offices and encourage more people to stay home. They are also limiting intercity bus travel and have ordered Chinese tour groups to cease operations starting Monday, January 30, 2020. The unprecedented scale of the response speaks in part to the sheer size of China. 60 million people is greater than the entire population of South Korea, and Hubei spans the equivalent area as Syria. Such a lockdown has never been carried out in China before, not even during the 2003 SARS outbreak. The cost of it is staggering, not just in terms of manpower or funds, but also the economic hit Hubei will take and the knock-on effect this will have on the wider Chinese economy during a sensitive period. With more than a dozen countries now reporting cases of the virus, along with almost every region of China, the ability to rein in the pathogen's spread may be somewhat out of the hands of the Chinese government. Fears of the spreading virus have already pushed airlines around the world to reduce flights to China and global companies to restrict employee travel to the country, while sectors from mining to luxury goods have been shaken by concerns for global growth in the event of a worst-case pandemic. New cases were also reported around the world, including Germany, where 4 people from the same company were infected after one of them contracted it from a colleague while visiting their workplace in China. The German cases raise concerns about the human-to-human spread of the virus, which can be transmitted in droplets from coughs and sneezes and has an incubation period of up to 14 days. Experts say it is too early to know what its death rate will be, since there are likely to be many cases of milder disease going undetected. Wang, the virology expert, said that Beijing is already doing the best any government can do by imposing quarantine measures, and only time can tell if that would eventually work. Hundreds of British citizens being flown back to the UK from Wuhan on Thursday, January 30, 2020, will be put in quarantine for 2 weeks. It comes as British Airways suspends all direct flights to and from mainland China because of the coronavirus outbreak. Australia, Japan, the US and EU nations are also repatriating citizens. Other airlines, including United Airlines, Air Canada and Cathay Pacific Airways, have already cancelled some flights to China. The virus has caused more than 130 deaths, spreading across China and to at least 16 other countries. Australia plans to quarantine its 600 returning citizens for 2 weeks on Christmas Island, some 2,000 kilometers (1,200 miles) from the mainland. Americans, also evacuated from Wuhan, will be temporarily housed on an airbase in California. And in South Korea, the police have been empowered to detain people who refuse to be quarantined. Since starting in the city of Wuhan, the outbreak has now spread to every province in China. The virus has also spread overseas, with cases reported in more than a dozen countries. As the virus is an entirely new strain, there is no existing immunity in anyone it will encounter. Some level of immunity will naturally develop over time, but this means that those with compromised immune systems, such as the elderly or sick, are most at risk of becoming severely ill or dying from the coronavirus. Dr. Michael Ryan, the WHO's emergencies chief, told a press conference Wednesday, January 29, 2020, that the estimated death rate of those who contract the coronavirus is about 2% lower than the 10% death rate for SARS. As with most diseases, the elderly, the very young and those with other health conditions tend to be at higher risk. Among patients with the Wuhan coronavirus, about 20% have become seriously ill, and the rest have a mild illness, the WHO said at a news briefing on Wednesday. Those who die tend to be older people with underlying ailments. The median age of the first 425 patients in China was 59, and a little more than half were male, according to a report published in the New England Journal of Medicine on Wednesday. China revealed that the vast majority of those cases, 81%, caused only minor illness. An additional 14% had symptoms described as severe. Just 5% of the cases were deemed critical, and half of those infections resulted in death. While the overall case fatality rate of the patients in the study was 2.3%, it was 8% for those in their 70s and 14.8% for patients 80 or older. Diseases caused by related coronaviruses are deadlier. SARS killed 10% and MERS about 35%. But if the new virus were to spread even more widely and a 2% mortality rate continued, the death toll could be considerable. However, if it is true that there are many more infected people than the confirmed cases, then the actual fatality rate is somewhat lower than that. And more like a seasonal influenza, which perhaps could be coped with more easily by the existing health resources.